Time now for Newstalk. Dr. Timothy Pfister is live in studio to answer your dental questions. The number to call, 315-793-WKTV. And before we get to any more calls, I want to talk a little bit about some new innovations that are available out there to treat gum disease. What was the old way?
Yes.
The easy way, I should say.
Well, the old way was bleeding on probing or checking pocket depths, which we still do, Jason, but now...
That's painful, though.
Well, you know what? There's ways of dealing with that with topical anesthetics and so forth. So it is important to get that depth of what is going on physically within the mouth. But you know, that's sort of after the fact. What we're trying to do now is be more innovative, where what we're trying to do is we've got a test called a BANA test. And what that means is it's a little strip that we take some of the patient's plaque and we put it on the strip. And the strip basically has a synthetic peptide that interacts with the bad bacteria's enzymes. So if that strip turns a certain color, we know those bacteria are present, which is not such a good thing, but we use it as a monitoring device to see how good the patient's home care is, and if they're doing a good job at home, then we can see that that's not going to turn such a distinct color. And so we can use that to really help the patient to know what's going on for them.
So the more bacteria you find on that strip, the more you know you've got some serious work to do.
That's exactly it, right. And it's, you know what, Jason, it's not the bacteria themselves that's the problem. It's what the bacteria do to the host or the gums of the patient. So that host is going to react to those bad bacteria and create inflammation. Inflammation is the key to what's going on with the breakdown. So if we can control inflammation, we control the bacteria, now we control the inflammation, and now we get no more breakdown.
Gum disease, if you have too much of it or it becomes a problem, that can lead to other health problems.
Absolutely, and it's closely related. You're absolutely right. A lot of other degenerative diseases, they've actually seen some of the bacteria that are present within the gums, specific for gums, in the lining of the coronary arteries of the heart. And it also, there's diabetes, rheumatoid arthritis, a lot of other degenerative diseases are associated with gum disease.
All right, good to know. We do have a caller on the line. Caller, go right ahead. What's your question? Lyle, go right ahead. What's your question?
Yes, I wanted to ask the doctor, what do you do if you got several broken teeth broken off and you're trying to find a dentist that, I mean, you haven't got any insurance, so where would we look?
Best thing to do is to call around, get a couple consultations, get some different opinions as to what might be able to be done. You have to be seen by your dentist to really get a good idea as to what is possible. Some of those teeth may be able to be saved and used with an overdenture. They may be able to be built back up with root canals and crowns. So every case is different, but you need to get in and get a couple different opinions.
All right, 315-793-WKTV is the number to call. We have another caller on the line. Brenda's on. Go right ahead. What's your question?
Yes, I have a question regarding dental implants.
Right.
And this is regarding the fact that my son had 2 back teeth pulled and had pins put in preparation for 2 dental implants. Before the procedure could be finished for the actual implant itself, he had to move to another state.
Oh, gosh.
Now, I guess my question is can he still, now this was approximately a year ago, is it still possible to have those implants put on, or does he have to start all over again because he's going to have to go to a different dentist?
That's a great question.
That's a great question. You know, the pins you're talking about may be mini implants which help to hold the bone there. That could possibly be what you're talking about, although it could also be that probably if they placed pins like that, they probably are conscious about grafting the sockets so that the bone height and dimensions stay there. So yeah, most definitely that new dentist can interface with the dentist that helped him here, and they can get to a resolution where he most for surely can have implants. I would imagine so.
We've got time for another call. Rosanna, go right ahead. What's your question for Doc this noon?
I have had gum problems for many years, and I do stay regular with my cleanings and stuff. Do you think that test you're talking about could help me?
Absolutely. If you know what, Rose, you're the perfect kind of patient that this would qualify for, because if you're staying regular with your normal cleanings, this device, this test that I'm talking about, is an aid to help you know where you are with your care. So if you contact your dentist. He can order this test or he can send away for it. You can then determine, wow, how good am I doing? What else can I add? We normally, if we see the patient is lacking in their home care, we order antimicrobials that can be irrigated directly down into the problem area. So the dentist will identify those problem areas for you, and he can help you to rectify the problem by these sort of rinses or direct rinses therapy.
All right. Thanks for all those calls, Doc. Always good to see you.
All right,
we'll see you next
Jason.
month.
Okay,
all right?
buddy.
More news is coming up after the break. Stay with us.